I see that digital's a way forward to allow patients to access treatment sooner, so it can reach those far-wide rural areas as well. They can access it from their own homes, and if they're unable to make it into treatment sessions, that they're not being without treatment.
Change is hard, therapy is hard, and we've been working really hard with NHS services and Talking Therapies to try and find a way to change the way people deliver therapy within their daily practice. And what we tried to do with the services is to understand what those daily problems were working with their patients. So if they had a platform that could help them deliver the therapeutic interventions they're delivering in a really engaging and interesting way, then they'd be more able to deliver more therapy to more people.
To use digital health interventions in the NHS, I think, is going to help us see more people. It can help with the caseload, time management, the staff to patient ratios.
As a clinician, I find using digital therapy really helpful. It helps to manage waiting lists, it helps to interact with the patients, and it makes it easily accessible for them.
It's really important to use research-driven tools because it shows that clinical evidence that these programs are effective, that they do have good recovery scores as well, and that they can actually support people with their particular problems. So it's critical that we are using things that follow NICE guidelines as well.
Amwell's product team has worked very hard within the SilverCloud platform to identify other programs that would be necessary for helping people with more complex conditions. We've begun the process of building and now deploying a trauma program, First Steps to Trauma Recovery. We've also built a space for recovery program, which is a more generic program for people presenting in secondary care.
We find it really important within our individual services that research is at the front end of everything we do, making sure that patients are getting the right care at the right time, using the right approaches to enhance and support them in their recovery at the earliest opportunity.
The advantage of the digital side is that they can log in at a time that suits them, and they can progress as much as they want at the pace that they want to fit in with their working lives.
So when we can use digital tools, it just reduces those barriers they face and just makes the work so much easier for some people to be able to complete the interventions they wouldn't be otherwise.
We need to allow them that time to go off and put the things in practice that we've discussed. So having the digital network alongside it means that after a week I can check in with them, but not face to face. It's, I've seen you've logged in, how have you found that? They know that they can connect with me and send a message that I will pick up when I log in and do their review. So it just allows me to have a bit of a better connection with patients rather than it just being that 1 hour every 2 weeks.
Patients have reported back to us that they find it helpful, that the content's very relevant, and it's helping them towards their wider treatment goals.
I cannot recommend the SilverCloud programme highly enough to anyone who's struggling with their mental health. I realise that each individual needs to be in the right space at the right time, but I feel confident to say that the majority would be able to find something somewhere within the SilverCloud programme and tools to help them.